Okay, the next medication that we're going to show you to prepare is your progesterone in oil. Now, you will not see this medication on your medication calendar that you have in hand now, but we will instruct you when you will begin taking this medication. This is also an intramuscular injection, so it does need to be given in the upper buttocks or your thigh area. What you're going to use is a 3 cc syringe with the 18 gauge 1.5 inch needle to prepare the medication, and then you're going to switch to the 22 gauge 1.5 inch needle to administer the medication. So the first thing we want to do is take our 3 cc syringe and apply the 18 gauge needle, and it twists on. And you can lay that to the side, open up your medication. Now, as you can see, this medication is actually an oil-based medication, so it is pretty thick. This is why you need to use the larger syringe to administer. So what you'll do again is you're just going to remove the safety cap, take your 3 cc syringe with the 18 gauge needle, remove the cap, then you're going to inject it into the vial of progesterone. Again, you want to turn it upside down. Now, there's 2 dosages of the progesterone that you may be prescribed. One is 50 milligrams, which is going to be 1 cc. And if you're prescribed 100 milligrams, it's going to be 2 cc's. So you'll pull back on the plunger of the syringe and fill it up about halfway again. Again, you want to try to remove any of the air bubbles by flicking it with your fingernail. And then you're going to push to the number that you're going to inject. So we're going to use the 1 cc syringe, or the 1 cc dosage. And once you remove the 1 cc of the progesterone for your dosage, you then need to change the large needle to the smaller needle, which is going to be the 22 gauge 1.5 inch needle. I recommend putting the cap back on the original needle and unscrewing, and then you're going to screw the new 22 gauge onto the syringe. And now you're ready to administer the medication. Again, this medication is given intramuscularly. We do recommend that you use your upper outer buttocks for the site that you inject, but you also may utilize your thigh area. This medication you should inject very slowly. I recommend patients count to at least 20 when they're actually injecting the medication. Again, it's in an oil base and it's very thick and it's going into the muscle, so it allows the muscle time to absorb the medication. Once you actually inject all of the medication and you remove the needle, I do recommend that you rub the area for about 1 minute to 2 minutes after the injection. This again allows the medication to absorb into the muscle more readily. Otherwise, you end up with little tiny knots in your buttocks, and over time of giving this injection, you will notice that they do hurt. Okay, the next thing I just need to let you know is that there are going to be several pills that you do receive with your medications. The 3 pills that you will receive are going to be dexamethasone, folic acid, and you're going to receive an antibiotic, which will either be doxycycline, Tequin, or Cipro. Now, what you need to know is that all of these medications you will utilize even though you may not see them on your calendar. So what you need to make sure is that you bring all of your medications with you to the clinic so that we can instruct you as to what medications that you will be prescribed. The other medication you may receive are going to be vaginal suppositories. Again, the vaginal suppositories will be prescribed to you at certain times. Some patients may take them on their cycle prep calendars, but most patients will start them after their embryo transfer. Again, they do need to be refrigerated, but you do need to bring them with you so we can instruct you when to start taking them. If you have any questions after you've reviewed the video, please feel free to contact your clinical coordinator, as I'm sure she will be happy to assist you in any questions you may have.